So CARTITUDE-1 is a study of a anti-BCMA CAR-T that uses the same construct as was used with the LCAR-B38 trial done in China. And so this was the phase 1B results that were presented. This was a very heavily pretreated population of patients who had had at least 5 prior regimens. Basically, the results look fantastic. So the overall response rate of the CAR is 100%, with virtually all the patients achieving very deep remissions, with 69% of them CR or better to this point. And of course, those responses continue to deepen with time. Now, the follow-up is only 6 months, so again, we don't have much in terms of the durability, but the hope is that these deep responses will continue to be durable. In terms of toxicity, we did not see any new signals. Again, cytokine release was common, but it was mostly grade 1-2. Neurotoxicity as well was seen about a quarter of the patients, but again, mostly grade 1-2. So very similar to other CAR products. The interesting part about this particular product is that it does differ in its time to onset of cytokine release. So when you look at other CAR-Ts across the landscape, not just in myeloma but other diseases, most of the patients who develop cytokine release develop it within 2 or 3 days of the CAR infusion, whereas in this study, the median time to cytokine release syndrome was 7 days. And so the likelihood or the reason perhaps for that is that we're seeing a slower expansion of the CARs, which must translate to a more sort of gradual effect and less immediate toxicities. And the other thing that makes this interesting is that if that sort of stands and it has this kind of characteristic, that may lend itself to be easier to infuse as an outpatient. Right now, all CARs are infused as inpatient. And so this may be the first product that maybe can have that potential.